Welcome to the Well Workplaces podcast, proudly brought to you by Pinnacle Health Group. I'm Tom Bosna, and today I'm speaking with colleague and great friend Andrew Maitland, who is a podiatrist, the director of the Melbourne Podiatry Clinic and soon to be Essendon Sports Medicine Clinic. Andrew, welcome to the show.
Thanks for having me, Tom.
Yes, and thanks for you on your. This is an early Friday sort of session. We're recording this, and pretty fresh morning here in Melbourne. Probably the first cold morning. What did you do this morning, Andrew, to kind of get yourself going? Did you do any running or any exercise this morning?
Managed to sneak out this morning pretty early for a run around the lovely Maribyrnong River, and yeah, it's a big shock to the system. 5 degrees apparently it was, but it felt a lot cooler. So yes, getting used to that and realizing I might have to dress a little bit more appropriately for this time of year, unfortunately.
Yeah, absolutely. Yeah, certainly a fresh one this morning, and almost time to start donning the gloves in Melbourne, which is Melbourne's a great city for running. And I guess with today's discussion, Andrew, obviously your podiatry background, your sports science or human movement background, and also I believe personal training sort of background here. So today I'm really interested in talking to you a little bit about kind of that concept of the corporate athlete, and especially focusing on physical well-being. So in contrast to some of the other episodes that we've had on the show. So I think, from my perspective, Andrew, in the corporate setting and the workers that we would see in our clinics at Pinnacle Health Group, there's that idea or that concept of the corporate athlete, which I might just explain how it sort of feels in my head. The corporate athlete in my head is kind of someone who has a career, works pretty hard, but also has athletic aspirations, and it normally ends up meaning that they are in that pursuit of athletic performance, but it normally comes second to their work and their other life commitments. So it normally means that, say, they might just be able to only really fit it in on the weekend, or they might have a gym membership and they'll get there sort of sporadically or through little bursts of conditioning. What tends to happen with the corporate athlete, or at least what I've been noticing lately, is there's been a lot of people breaking down. So the timing of getting you on today is to kind of I'd be really interested to hear from you around what's happening from your perspective in with your teams in your podiatry clinics there, and also just touch on some of the other things around running and performance in general, because I feel like a lot of people need a little bit of attention, a little bit of advice now around how to get kind of back into shape after what's been a pretty inactive 2 years. So Andrew, I might just kick off with what sort of things are you seeing at the moment in your centres?
So I certainly have noticed over the last couple of years there's been a shift in the way people are moving. Whether on one hand they might have been moving a lot less, or on the other hand they may actually have been moving a lot more, because it was kind of, for a lot of people, the only thing that they could do during the lockdowns and things. So clearly running's obviously relatively low tech, doesn't involve any equipment, doesn't involve a gym membership. So a lot of people during the last 2 years went out and run, and a lot of people who perhaps never have run before. So we definitely saw a big increase in injuries that we normally see, but the volume was quite impressive. And I guess some of the severities that we were seeing of some injuries, such as sort of bone stress injuries, in very early stages of running. So we were seeing them in sort of the first 3 to 4 weeks of someone starting running, which is unusual. And so obviously for a lot of these people, perhaps running, this was the first time they've even run. So there was definitely a case of there's a lot of these people coming in presenting with Achilles injuries, shin pain, a lot of these conditions that often has a significant conditioning element to it. And really it was because I think a lot of these people were doing an activity that they've never done before, and perhaps haven't had previously any advice on where to start, what shoes to wear, and how to actually construct their running program.
Yeah, that's interesting, and the volume sounds pretty out of the ordinary in terms of the amount of injuries or people presenting to you. If you kind of think back a couple of years, Andrew, and maybe through your friends and family that you would have noticed, obviously people working from home and just the activity levels and the movement that we were doing in our days when we were working purely 100% from home. I mean, I noticed that my step count, for example, whilst it's not a great measure of activity, it was pretty much around 30 to 40% less than, say, if I went and commuted into work and just walked around with incidental movement. Did you find that as well with like yourself and other people that like just that incidental movement as well through those lockdown periods?
Yeah, I think you just noticed a real big drop in that sort of exercise that we don't probably really register. Like you really had to make a conscious decision to be active during the last few years, and I think that's been, for some people, that was their sort of outlet that do it, but a lot of people, I think the vast majority, really struggled to do that, and that general sort of movement. And we're not necessarily talking, for causing injuries, but it was just moving, and whether it be, normally you might go down 3 or 4 levels to go and grab yourself a coffee, you might catch the train to work and walk in from the station. Just no one was doing that. So really the only time people were generally moving is when they consciously made a decision, okay, I'm going to go out and go for a walk. And I think that was the big distinction where people really were doing a lot less than they would normally have done.
Yeah, that's a good point. We've had some examples coming into our centres when you haven't seen people for 2 years, and you're like, oh my God, you've lost about 15 kilos. Like you look half the person you used to be, and that's because this was individual had gone, all right, I've got this lockdown or this couple of years to really get myself in shape and kind of undo all that corporate athlete kind of inconsistency that we sometimes see. And then there's been, I reckon, a lot more that through those couple of years or the last 12 months where they've told me and many of our team members that they've put on about 5 to 7 kilos. And I've read something a little while ago that was saying that the average weight increase over this time was on average for men, I think it was around that 5.5 kilograms, which is not it's enough. It's probably more than a winter coat, right? But it's then when you try and get back into some activity levels, you're going to notice that extra weight. Is that something that would contribute in your experience to more of those, I guess, running type issues as well?
Absolutely. I mean, if you're carrying more weight, it's going to change the amount of load, I guess, but it's also going to contribute to your center of gravity and things. So it's just going to be an adaptation. I think there's definitely that side of it, but I think the vast majority is just that sort of atrophy or that I guess that loss of strength and muscle range of motion and joint range of motion, all those things that we know are super important with running, that really people through lack of movement have undone a lot of things that they may have built up previously. And that incidental exercise can be often really quite useful in maintaining that. We might not see any significant improvements from it, but it's really quite good at keeping people moving and improving things like posture and things. So yes, it definitely did have a little bit of an impact, I think, generally.
Yeah, for sure. And now workplaces and offices I might just take a step back away from running just for 1 second, because I've got an interesting question for you. I think with the last couple of years, if you think back 3 years ago, what did people wear to work on their feet? Or especially I'm thinking women here. So they might be wearing a heel or something that's maybe more fashionable. And now in the more recently, the footwear has really changed, and maybe the expectations around what you can wear and what you can kind of get away with now in that more casual sort of look has changed. from what you see, and obviously your expertise in footwear sort of range, and also probably seeing a lot of women as well, no doubt, with these issues.
Yep.
How has workwear changed for maybe we'll focus on women here. So what's changed for you when you're giving recommendations for footwear for work?
Yeah, good question. I mean, there's probably 2 points here. One, the first point's probably exactly what your point is, in that maybe there's been some changes. The second point, I think, is that perhaps people getting back into the office maybe are pulling on the heels that they were wearing 2 years ago, haven't worn them much. And similar to returning to running, there's an adaptation that needs to occur to suddenly wearing a 2-inch. So yes, I think there's definitely perhaps a bit more concessions being made. People are a bit more aware of it. They've also had 2 years of getting used to not, waking up with sore feet after spending a day on their feet in heels. So I think generally workplaces have realised that, if they want their people back into the office, they do need to be a little bit more understanding of that. And I think people have probably said, well, I'm sick of having sore feet, and maybe the general sort of vibe is that people are more accepting of it. But I think the other important consideration is that a lot of people still want to come back and wear high heels. They've been around for decades. It's something that people will want to get back into, and we've certainly noticed in the clinic that women are coming in and saying, "I'm back in the office. Those shoes, or that orthotic you designed for me to treat this certain issue, was working so well the last 2 years. I'm now back into nice dressy shoes, and my issues come back, or I'm starting to get some calf pain, or all of these things that we're seeing that may not have even been there previously. It's just a case that they haven't been doing it for 2 years and are suddenly reintroducing it."
Yeah. It's a good point about people now actually. Like, there was a lot of clients that were telling us that they'd literally wore UGG boots for a year working, in their living room and that kind of thing. And then, suddenly I've got the corporate wear on again, and my feet and my body is just screaming at me. So it's kind of an interesting adaptation back to, I'll say normality. And with that, Andrew, I guess with those people that are having to adapt back in, where they are wanting to wear something corporate-y, when it comes to, from a podiatry perspective, what are sort of some of the main, I know you can't give specific advice, but what are some of the things that you would normally recommend in that scenario? Obviously there's a conditioning element here as well, probably.
Yeah. So like anything, it's about introducing it in a way that allows your body to adapt. Just like if you're returning to sport, you do need to obviously prepare your body for that sudden increase in load, and it's no really different to this situation. Simple things like, we see people doing it is, one of our recommendations is, if you do have a commute, don't do the commute in your high-heeled shoes. Bring a pair of runners that you can put in your bag. Walk to work. If you've got a meeting, or you've got time where you do need to be dressing a little bit more corporate, you can put them on. But yeah, just managing the load. And I think, look, most people aren't back in an office corporate setting 5 days a week yet. So that in itself is probably going to help them gradually reintroduce it. But I think just being mindful of it, because it's just a simple thing that you can do that hopefully prevents some issues occurring in the first place.
Yeah. And when you say load, like you've said the word load a couple of times, just to explain, can you explain that a little bit? Is that's more to do with the amount of pressure going through the body, or how would you describe that?
Yeah, it's probably all of those things. It's certainly the amount of, I guess, stress, and this can be stress sort of times time. So you can have certain stress on a body part, whether it be a joint or a soft tissue structure like a tendon. And if it's for a short period of time, the tendon tends to sort of adapt and to handle that load okay. If it's over a prolonged period, that repeated exposure is more likely to increase your risk of injury. So structures have a kind of a break point, and if you continually expose them to that break point repetitively, the net result is that you have some form of change that causes an injury or pain. It can be obviously like as simple as a skin breakdown in the forefoot for say a high heel wearer to like an Achilles issue, that both can be sort of susceptible to that repetitive load.
Yeah, no, mate, that makes perfect sense, and yeah, thanks for explaining that one, because I feel like I think sometimes our health professionals say load a lot as a as a way of describing what's happening, but for some people they're often like, what does that actually mean? Perfect. Yep. Yes. So Andrew, with exercise levels at the moment, so just in general with from who you're seeing in the clinic or what your teams are seeing, what's some of the things that people are now, do you feel like people are now getting into things like running a bit more, given that it's kind of into that running season in Melbourne, or what are you seeing there?
Yep, definitely. I think people have, I think running, despite obviously, running having sort of that aura about it as being, quite stressful to the body and quite challenging exercise. I think running is a fantastic exercise to do. It just needs to be done with a certain level of, I guess, caution, or certainly level of sort of progression to it. But we've been seeing a lot of people getting back into running. I mean, it's so good to see running events back in Melbourne. I went to watch the Run for the Kids. My wife ran in the Run for the Kids, and the sheer volume of people at Docklands and around the place was fantastic. So yeah, we're seeing, and I think the last couple of years has probably been a pretty good recruitment drive for running. It was something that people could do, and I think they've realised that it's a great activity. It's a great way to get out and get fresh air and deal with the day-to-day stresses and all of that. So yeah, I think we're definitely seeing it. And I think with more and more events now on the calendar, and people have got that bit more confidence that, if I put in the hard work, there is going to be an event for me at the end now. And so, yeah, it's been a fun time to see lots of people coming in. Sure, they're coming in generally because something's gone wrong, but most people are, with that goal in mind, and that's those people are fun to work with.
Yeah, awesome. A lot of the clients and people that we're seeing in our centres, some of them are literally starting, so they're kind of they are interested in running, but they're sort of almost right at point one, and as I was mentioning earlier, the weight gain is often one of the motivating factors for doing something like running, but also the other benefits of getting mental clarity and having that as a bit of a stress outlet. And often these clients are people where they have ran before in the past, but they're just sort of like, they're just needing to start right at the beginning. For those types of people, Andrew, you've probably got clients that coming in that are experienced runners and they're breaking down and they need, your help or your team's help. What about the ones that are starting right at the start? What are you sort of normally giving in terms of advice or tips for those types of people?
Yeah, have a plan is probably number one. I think if we look at what the main cause of injuries that we see is, it's training errors. So that can be anything, but it can be obviously the surface you're running on, it can be the volume, so that basically the amount of running that you're doing, whether it be throughout the week or individual sessions. It can be the intensity as well. But often the main reason why people tend to get injured, and it often occurs in that first sort of month, so this first 4 to 6 week mark, is because they just do too much too soon. So they exceed their body's current capabilities, meaning that we're talking about, if you've got like sort of that break point that I was talking about earlier, that can be raised. So the more training you do, the more running you do, the more strength work you do, that can be improved at a certain level. If you haven't been running, your body hasn't had an opportunity to adapt to that. And what we want to try and do is introduce running in a nice controlled way that allows your body to then adapt, recover, and then so you can go again. Very similar to if you're working at a gym, you wouldn't just go and hit the same weights 6 days, 7 days a week. You want to just expose your body to a little bit, let it recover, they get a bit stronger, and then gradually increase it. And having a plan where you kind of forces you to do that. So a lot of people get a bit carried away and suddenly go out, and particularly if you've run before and you were quite, you're running quite regularly and you've had maybe the 2 years off from COVID, you then get back into it and you think, oh, okay, I used to run at 4-minute K pace or 5-minute K pace for a 10K. I'm just going to go out and smash that out. And those are the people that we tend to see that get injured.
Yeah, that'd be me, mate. I think I have been a runner in a past life, and if I went for a run now, I'd be like, yeah, I reckon I could do 10Ks. I was going to say 10 kilo, 10Ks.
Especially when you see someone that you think you should be beating running past you.
That's right. No, that's great, mate. They're all good considerations. I think one of the other ones or programs that I've heard a little bit about is the Couch to 5K kind of program. I'm assuming there's a bit of methodology around that and structure. Is there anything that relevant out of that you might recommend for new starters who are basically need to start with walking? Is there anything out of that that's handy?
Yeah, it's a great option. I mean, we find it's great in the start. It tends to sometimes, some people ramp up a bit too quickly in the latter stages, but it's a really good way. And I think what it forces people to do is what I was alluding to before, is it helps you maintain a structure to your training. Simple things like don't run on consecutive days. When you're first starting out with running, interval training is a great way. So you're doing sort of maybe a faster run followed by a walk. It's just a way to introduce. So we're talking about exposing the body to that load, that stress. We want to expose it in a way that gives that opportunity to recover, rather than avoiding that repetitive exposure, that repetitive load that often causes someone to break down. So yeah, it's a great way. It's helps you get through that sort of risky period, as I said, which is those sort of 4 to 6 weeks.
Yeah, that's great. With that, that 4 to 6 week sort of time frame, if you like, I guess taking a step away from running for a second here. So with podiatry, most of the reason people come to podiatrists are for initially in their heads anyway, they think it's all to do with feet. Are there any, if people have really lost their conditioning, are there any key things that you would recommend or your team would recommend around conditioning for your feet, stuff that maybe people haven't really thought about before?
Yep. Definitely. Probably the three, if we look at the 3 tests that we do with every runner, one would be the knee to wall test, so the lunge test, which is measuring your ankle flexibility. So we know that poor ankle flexibility has a big impact on a lot of structures within the foot. So that's a simple one. And you just jump on YouTube and Google knee to wall test and you'll see how to do it. It's a measurement. We're looking generally above 10 centimeters for that for someone. The other one is single leg calf raise. This one's, I'm continuously surprised how poor people are at this, and some really quite good runners can struggle to do 10 single leg calf raise as well. So that's one that I think, if I was to say which exercise you should work on, it would be a seated calf raise, working the soleus, which is the powerhouse muscle for running. Glutes get a lot of attention, so physios will bang on about glutes. We bang on about the soleus. Soleus is that sort of lower calf muscle that attaches down into the Achilles, and it's the one that kind of does, it's basically continuously working really throughout running. So that's a big one. And the last one is a single leg squat. So having a look at how that whole lower chain is working. So knee position. So if you're finding you're very unsteady, that knee's sort of dropping in, we know that you're a bit susceptible. So they're probably the 3 things we'd want to look at. And then we'd often then get someone running. And that's obviously, we can then start to see, well, how does that translate into their actual running technique? So I think everyone should aim to see how many single leg calf raises you can do. But ideally, we really want to be doing, for most people in their 30s to 40s, you should be aiming to be doing at least 20 single leg calf raises well, both legs.
I love that. If you're listening to this, get on the calf raises now. And I'm terrible. I'm actually one of those people that are terrible at that, Andrew. So yeah, that's really good. Those three, I guess they're quick screening kind of ideas or tests for people just to look at themselves prior to considering running, or even if you are running but kind of breaking down. Check those ones out. Andrew, great tips today, and thanks so much for your time on the podcast and on the show. If anyone wants to connect with Andrew, we'll be adding all the details into the show notes, and we'll add in those 3 tests as well so that people can cross-check those. But yeah, thanks again, mate.
No worries. Thanks for having me.